just do this.
Hey. Welcome to the Right PT Show. As you saw here, Alex was jumping, trying to get as tall as me.
Jumping for joy.
Dell in the background said I looked ginormous, was her words on the video. So now I'm just going to do this. I'm just staying right here the whole time.
Don't humble yourself like that.
Cade's in the background over here. If you know Cade, he's always saying and doing stuff. He's just going to make an appearance, and he hasn't even been invited to this.
Oh, okay, I see what's happening.
Power move.
I just wanted to say hi, Mom.
Get out of here. Jonah, a new sheriff, is in town. That's Cade's son. So, we're here today with Dr. Alex White, DPT, OCS, Orthopedic Certified Specialist, and several other credentials. Alex has too many credentials. Alphabet. So it's good to have Alex. I'm Dr. Tyler Billings. Both of us are partners here at Right PT. So we're excited here today to talk to you about the most recent question that we got, which is timely because we're heading into football season. Yay. Right, that's upon us, right? Those practices are going to start up probably about a week or two. So the question for the day is, how do I recognize that I have a concussion, and what steps should I take? So as you think about that question, just think on it here for a minute, and maybe someone that you know has had a concussion. But I do have an announcement from our team before I dive into this topic. I'm just going to read it because I'm going to get lost if not. Best of Greater Idaho Falls voting will be open. We encourage you to go to bestofgreateridahofalls.com to vote for Right PT in 2 categories. So we've been nominated in 2 categories. Best in rehabilitation therapy, and best in customer service. So thank you, Eastern Idaho, for nominating us. Voting is now open through July 21st. We will have our link on Facebook, and we will put a link in the comment box on the Facebook Live today as well. So you have that link of where you can go. So thank you if you feel that we are deserving of that, of best of rehabilitation and best of rehabilitation therapy. That's interesting. So best of rehab and best in customer service. So we would appreciate that. So let's jump back in. Now that you've had a minute to think on the question, how do I recognize a concussion? And what steps should I take? Like, now what? It's become such a craze in the world, right? And it's not overly sensitive parents. I used to always think that back when I was younger. Man, parents are just getting like overly sensitive with this. It's the research. It's backing up what's going on in the brain when there is a concussion. What kind of biomarkers are there? Meaning, evidence of there's been a concussion and what's happening in the brain. It's a lot of research on this right now. I'm not going to get crazy into that, but basically let's talk about, first of all, what is a concussion, right? A concussion, if I was going to smack Alex's head super hard in the forehead, or a blow to the neck. A lot of people think it's just a blow to the head. We recently went to a conference with the NFL, and the NFL talking about the brain labs. It was interesting. Last year in Minnesota, and they talked about concussions are not primarily a blow to the head like in football. It's also the pads I'm hitting, and it's the jostling of the neck over and over in practice. A majority of the concussions are happening in practice, and then someone steps into a football game and then gets rocked once, and then the symptoms are already there before that even happens. I thought that was interesting. It's repetitive jostling of the head over and over and over and over, which is why you should be careful with your coach, especially in these small towns in Idaho, of being careful. How many days are you doing contact practice? When the pads and the helmet are on and you're hitting each other over and over and over, predisposing you to
how much time you're spending working on the proper way to tackle using pads that have gone through a lot of research.
Yes.
Unfortunately, we treat ourselves like a battering ram until we can't.
Yeah.
And so learning the tackle, because I know once the pads get to come on, fire burns a little bit hotter. But definitely taking the time and taking the, I'd say, initiative to go slow to start. Yeah. Huge tolerance builder right there.
Big time. So what's going on in the brain with a concussion? So you have these neurons, the cells in the brain, and they look just like this. But they communicate to each other, and they use neurotransmitters, a chemical that's going to release from this side to this side, back and forth for communication, for memory, for concentration, for all of those types of things. And when you have a neurotransmitters are hyperactive and they're not communicating the way that they need to, and that's why you see difficulty concentrating, irritability, right? Like I'm just irritable,
to light and
right?
sound,
Sensitivity to light, sound, because there's this overreaction inside of the brain. And so that's why it's really important at the early stages that you recognize a concussion so you can go into concussion protocol. You hear that a lot, right? Like on ESPN or in sports, like concussion protocol is underway, and there's a reason why that is. So let's talk about testing for this. You hear a lot of baseline testing. There's a lot of different types of tests. You'll see this in high schools, definitely at college, sometimes in middle school, depending on the area that you live. But there's a baseline test that's going to look at your brain function before any injury has happened. Like in your current state, how good are you at concentrating, focusing, memory, recall? So there's this baseline test that you'll take. Probably takes about 45 minutes to an hour. And I hear a lot of the high school kids like, man, that's a tough test even when you don't have a concussion. There's a reason why, right? It's going to be tough in your current non-concussive state. So when you do have a concussion, or they suspect that, then they can monitor how are you doing with the concussion. Because the typical answer, if Alex is a football player in college, and I'm like, Alex, how are you feeling with your concussion?
I'm good. I'm ready to go.
I'm ready to get back in the game. Please put me in. So there is specific criteria that you must utilize along with the baseline testing that really knows that, hey, can you get back to sport safely? So that's the take home here of my first section is a lot of research has been done for concussions. We have collaborated with sports medicine doctors in all the local areas that we work to establish an amazing, this is just the beginning of several pages of how do we progress through a concussion, how do we assess it, how do we appropriately say you can go back to sport. So Alex, take it off. Let's talk about recognizing a concussion.
Yeah, and I would say this is the most crucial part because concussions can present in different ways. A lot of times people just assume if you didn't lose consciousness when you got hit or you didn't do that, it couldn't be a concussion. They have since disproved that theory. Basically, if you lose consciousness, it's a concussion. We're out of the game. We are starting concussion protocol. If there isn't a loss of consciousness, there's more parts to that. It's not just a catch-all, but basically we need to rule it out before we ever assume that, it might be a concussion. It should always be the first thing on our mind. This is primarily done on the field, usually in our athletic environments by an athletic trainer, or in some instances if a physician is on site on the field with them. Biggest thing is to take it cautiously, especially when we start talking later in age groups, is that assume it's a concussion, get them out of the game and do the proper evaluation.
Nice.
We need to address it early, and we need to assume until anything that can even rule it out, we go through all those tests to make sure that athlete's safe. What we've found over time is the chronic concussion or multiple concussions over the lifespan or lingering symptoms following concussion without that proper evaluation or proper addressing leads to so many more issues, and I would say it's one of the least treated or most undertreated population when it comes to head injuries. Is that chronic post-concussion syndrome, which happens when either an athlete returns too soon, needs to take longer to get there, or they never had it diagnosed in the first place. I think everybody, when we get to our 20s, 30s, 40s, 50s, we hear the word concussion, we think back, oh yeah, I probably had one of those, instead of a proper diagnosis and treatment plan. And so that identifying, another thing that lumps with it, is always assume if the head is injured, the neck is injured too. And so this is where athletic trainers are highly skilled and trained in ruling out the cervical spine or the neck before they ever sit an athlete up after an injury like this. And if there's even a shadow of a doubt, they are put on a spine board and they go get an x-ray. They go through the proper steps that they're trained in before they ever come into a rehab setting.
And how grateful I am to know that there is a team that's involved in sport with a concussion. Right? There's multiple people involved in getting someone back to sport. First of all, you got the coach, you got the athletic director, right? You got the family physician. There's a physician. If you're in high school sports, you better hope that you have this. you should have a physician who's overseeing what you have. Luckily in the Magic Valley in these bigger areas, we have a sports medicine physician that oversees all of this, and then you have athletic trainer. An athletic trainer is critical because they know what am I ruling out, what can we do here, and that they're trained to do that, get you off the field safely, which is and also to help you get back on the field with a concussion. So athletic trainer, and then the final piece would be that physical therapist, right? You must have a physical therapist on that team to go through the assessment, the rehab, and return to sport function of that.
Yeah, and I think a large indicator is until you get all the parts, until you, with the expression that we've been using lately, is until you build that bike of what that patient or that athlete is feeling, until you get all the parts to it, you don't know how to rehab. We're not putting somebody into a rehab program that everybody gets the same thing. Concussions can affect a variety of ways. That's why that evaluation, both on the field and follow-up, is so crucial, is that some people have vertigo where you get dizziness and that spinning of the room. Other people get balance issues. Other people, you don't realize it until their heart rate gets up again. They don't even realize that they have a concussion until they get to full speed. Those are things that until you make that thorough assessment or that evaluation, which a lot of times you can't do on the field, you cannot say without some uncertainty that they're ready. And that's I'd say the crucial part of that team is parents, I would say, is another one. Especially with student athletes, the parents definitely need to be aware but on board.
Yeah,
unfortunately, peer pressure is too strong when it comes to this, just because it's kind of I would say not a silent injury but an invisible injury. Is there's not a scar on your skin that tells you when you're ready. There's not a range of motion in your knee that says when you're ready.
Really
it's truly exertional, and so figuring
and
that out.
A lot of it's very symptom based, but based off of the research of like, we're going to try to reproduce symptoms and try to push where we need to, and then it's in a closed environment, in a clinic. That's why a physical therapist is critical on the team, is because in a closed environment, when no one's hitting you, there's no loud noise, there's no loud, changes of pace. Like in a clinic, can you get to a heart rate, a certain level where you don't exacerbate symptoms, bring symptoms back on? And if you do, then you're not ready. Right? There's clear protocol on that. So we went recently, Alex, to a conference in San Antonio, love Texas. That's where I went to PT school in Dallas, but in Texas. But we went to a conference, like the main conference for concussion, right? Evidence of motion, and a lot of research, a lot of grueling training to bring back what we've brought back. So they talked about some certain things which we've already talked about, like recognizing the concussion. The next R inside of that protocol was remove and reevaluate. Tell us a little bit about that.
So removing them from sport. So this, I think football is the one that's on everybody's mind. We said it at the beginning, is take that helmet away. We're off on the sidelines, and I think this is where we forget sometimes, is removing can sometimes mean going to the locker room as well. You have whistling, you have fans cheering, you've got bright lights. That is not removing the stimulus fully. So remove is a very, I'd say, concrete term of you need to get them away from what just happened. You need to get them, and sometimes you can't do that on the sidelines. I would say if you can't control the environment, you're not removing the stimulus. And so remove and assess. So that's that reevaluate is we're seeing if they have a concussion. We're seeing if they have, we're seeing if they have a headache. We're obviously ruling out in or out a concussion, but headache, we're looking for sensitivity, we're looking for movement restrictions, we're looking for a variety of things. We're testing their balance on the sidelines. When you have a high level athlete, you aren't going to have them stand on one foot and say, oh, that looks good, you don't have a concussion. Their sport is what we're returning them to. And so just being realistic with it is sometimes you can't make that call on the sideline, and sometimes you can't make that call in one visit until you get to know that athlete. And so that's where the reevaluate is a continuing process. Like Tyler just said, we want to figure out where your threshold's at. But I would say without a shadow of a doubt, you should feel confident to either say they're ready to go, and if there's not, then they need to be withheld until you can do a full assessment. I think especially, and that's more and more true the younger the athlete is. Unfortunately, I'd say the NFL sets a weird stereotype of, oh, they got a concussion on this Sunday, but they're playing next Sunday. Unfortunately, that is not the case, and there's a huge spectrum, and it depends is the phrase we all use. But for that subject of one, there's an average that we'll talk about here in a minute is we need to make sure that that one person sitting in front of us or in our office or on that sideline is safe and ready to do that.
Yeah, well said. I like what you say about reevaluate. Always in the medical world, it's test it, find out what it is, treat it, retest. Right? It's not test it, treat it, and carry on your way. Like you got to retest, reevaluate. Where are you at in the process? A concussion can change from day to day. I still remember one high school female athlete. Like we were like right at the edge of concussion. We're about to send her back, and then we put her through the grueling process to make sure she met the criteria. And like on the final test, it was like boom, symptoms all back. Right, like we were one test away of sending her back to the sport, and we couldn't.
And
Right?
if you weren't thorough, she could have had the risk of re-injuring an already irritable concussion, and it would be worse.
Yeah.
I think unfortunately we're too wishy-washy. Like it will be worse. It will take longer to heal. It will, have all these other issues if you don't take care of it the first time.
Yeah.
You take care of it correctly.
We have a mutual friend, both Alex and I, that struggled with concussions through high school sports, and now even in adulthood has these struggles, right? Like just a couple of weeks ago, bumped his head into a counter, fixing something, and passed out, right? Massive headaches or a ball hitting into the head, playing with the kids now releases all of these symptoms that were in the past. So it's interesting to find in the medical world how little some people know about concussions. I'm not saying everyone does, but it's still an area that's not super well known and can get mishandled real quickly. And those things can just perpetuate into adulthood, and where you have those problems with sleeping. This mutual friend that you and I have, problems with sleeping and different things that way, which could have been handled before. And even high up people in the chain in the medical world are saying, hey, there's not much we can do for you. Basically, just don't get a concussion again. I'm like, wow, that is. I hope you didn't get a bill for that. Right? Like that's like me saying, oh, my knee hurts. Like I don't know, just don't do things that hurt your knee. Like
it hurts in the morning. Just wake up in the afternoon.
Yeah, just wake up in the afternoon. So you have to really know where you're going and get advice from people that know what they're doing.
Are passionate about it and proficient.
You gotta have passion and proficiency in anything that you do in life, especially with concussions. Like you're dealing with a vital organ of the body, the brain, and the brain is so powerful and unique, and it controls everything in our body. Everything functions off of the brain. But the next R that we want to talk about from this conference was rest. Right. So the old school mentality back when I was in high school, that tells me how old I am. Back when I was in high school, never thought I'd say that. Back when I was in high school.
Back in my day.
So back in my day, they would say, hey, go in a dark room, right? And make sure you don't fall asleep. Someone needs to be on watch with you the whole time, but do not fall asleep. Only a dark room, only sunglasses, right? For days and days and days, they would tell people that. Now, in the era, we're saying, get sleep naturally, right? Like you don't need to force yourself to sleep.
Like get on
a schedule, get the rest you need, especially in the first 48 hours. Because remember, the neurons are just all heightened and they're hyperactive. Like simmer down. We always call it live that grandma life. Right? The grandma life is like I go to bed at 9:30. I wake up at a specific time. I eat this.
You have a structure.
I have a structure to what I'm doing. I don't over push it, right? Some grandmas might, but grandma ain't out there doing plyo jumps in the garage, and she ain't out there mowing the yard in 100-degree weather, right?
Going for a walk, getting those little things, just basically that rest and digest. I think is a big one. Is you got to make sure you're still stimulating your body, but it should all be sub headache, and that's kind of going into the next step is when do we start rehab?
Yes.
And I think the general concept here is that the sooner the better within that first 10 days is basically non-negotiable. Is that first 10 days they need to start the recovery process because that's when the brain is going to be the most receptive to feedback. Is the further along, I mentioned something earlier called that post-concussion syndrome, is that the further out you get from a concussion, the harder it is to treat that concussion. And I think that makes, kind of makes your kind of shiver a little bit because I don't know how many people went with a concussion. They either went undiagnosed or just rest until you don't have a headache.
Yep.
The rehab process is going to be involved based on what symptoms we find. It's very thorough, and it starts low intensity, gets higher. Is that we need to figure out what the lowest hanging fruit is and start picking it. We need to start getting, whether it's literally light, we need to put some sunglasses on you.
Yeah.
We need to, if it's your sound, you're too receptive, we're putting in earplugs. We're getting you to that point where you can at least get to baseline.
Yes.
And then we're building the bike. Then we're building the person back. Is we're putting together the symptom profile, and then we're training it, and we're putting things back into that normal.
Nice.
Everybody's normal is different. Like a football player that plays receiver versus offensive or defensive lineman, rehab's going to be different. Somebody who has headache or dizziness is going to have something different than somebody who just has balance issues.
Yep.
Everything depends on that rehab process of that thorough evaluation. And then really time frame is, I'm just going to say it's variable. That's the elephant in the room. Everybody wants to know how many days am I out, how many games am I out, how long is it going to be like this? And everybody hates my answer of it depends.
No.
It is unfortunately, or fortunately I would say, this puts you in the driver's seat, is that it depends on how you meet these criteria. And this is where protocols are nice. Everybody's different. Everybody hits different protocols, different stages at different times. Different people get affected different ways. And that is where that retest, like you said, we test, we intervene, we retest. That's the gold standard. And I would put that clinical pearl against any sort of mantra or guru out there, and I guarantee it will hold its water.
Totally. So it's time frame, right?
Yeah.
It depends. The general rule here is the younger you are, the younger your brain is, the longer it takes to get back to normal baseline behavior and function. So an adult that gets a concussion is like 2 to 3 days.
Uncomplicated.
An uncomplicated,
Yeah.
straightforward concussion, on average 2 to 3 days. A college athlete, 7 to 10 days, uncomplicated.
Okay.
A high school athlete, an uncomplicated concussion, 14 to 21 days, right, on average. And then a middle schooler, 26 to 35 days. Makes sense. Our brains, by the way, don't fully form to full fruition till age 26 in multiple studies. So it's interesting. It's interesting. The younger brain, it gets jostled. It has that tiny traumatic brain injury. It's going to take longer to heal.
And so thinking about like an injury is like you talk about like you tweak your knee and it's like it's warm, it's metabolically active is what I want to say. Well, now imagine if you're in a closed system where your brain is surrounded by bone, there's no place for that inflammation to go. You can't poke your inflammation in your brain. I don't want you to try either. But do you want to talk about metabolic activity? Think about how quick a middle schooler or a high schooler just grows. Like I'm thinking of your son, it's probably taller than me now. But they just grow. Their bodies are so active. Now you take this already active brain or metabolic system and then you heighten it. That's the importance of that time frame. And this is where we said uncomplicated probably 10 or 20 times. This is where you had a slight, I would say, rattle. You have that headache. You wake up the next day and you feel a little better. You wake up the day after that, you feel a little better. You're able to do your normal routine in 2 to 3 days. Now, athletes are going to have a different daily activity, and I think we'll go into a little bit of the rehab. I want to put you on edge a little bit for next week. Is talking about what the rehab may look like, what some of those, diving into some of that time frame a little bit, what we would work on with therapy. But I think the big concept we want to make sure is no ifs, ands, or buts, is that we need to identify it. We need to classify it or put it into a thorough process of evaluation, and we need to put the team in place and the plan in place in a realistic time frame to get them back to what they need to do.
It's solid. If you have questions on concussion, writept.com looks up at one of our 14 locations. Alex, it's been great teaching with you today. But the take home, I would say, just like what Alex is saying here, is getting a proper assessment, following the appropriate rehab protocol, and establishing what is the criteria that needs to be met for you to return back to whatever it is, work or sport. Stay tuned for next week. We're going to talk about what do we do for rehab. So we're not doing squats for concussion, right? But we're going to talk about what does that look like and what can a physical therapist do to help you get back safely.
Great.
Any questions, Del?
Nope.
All right. Thanks, guys.
Thank you.